Hi guys, welcome to Nurse's Diary. Today we will discuss about sinus bradycardia. Sinus bradycardia means the sinus heart rate will be less than 60 beats per minute. Now understand how it will occur. It can occur to a well-conditioned heart. It normally occurs during sleep to decrease metabolic demands of our body. It occurs to a fit person like an athlete. Because they are fit, their heart can maintain a normal stroke volume with less than normal sinus effort. Kids are fit, their heart can maintain. Now we find out how it happens. It happens due to vagal stimulation increase, like the sleep, deep relaxation, or Valsalva maneuver. Or second one is the sympathetic stimulation decrease, like the automaticity in the SA node diminishes. Automaticity means the tendency of cells to initiate their own impulses. The conditions during sinus bradycardia, tolerable conditions, that depend on the rate. If the rate is between 45 to 59 beats per minute, most of the people can tolerate it. But less than 45 beats per minute, the less number of people can tolerate this. The causes of sinus bradycardia. The non-cardiac diseases are like hyperkalemia, increased intracranial pressure, hypothyroidism, hypothermia, sleep, and glaucoma. All are non-cardiac disorders which cause the sinus bradycardia. Second one, the conditions producing excess vagal stimulation like sleep, deep relaxations, Valsalva maneuver, carotid sinus massage, vomiting. Third reason is cardiac diseases. It is one of the sinoatrial node disease, cardiomyopathy, myocarditis, myocardial ischemia, and one more is immediate following an inferior wall myocardial infarction. It is the most important thing that the sinus bradycardia follows the inferior wall myocardial infarction. Few drugs are used to these conditions, like drugs are beta adrenergic like propranolol, digoxin, calcium channel blockers, amlodipine, lithium, antiarrhythmic, sotal, amiodarone, propofan, quinidine. Then we talk about the treatment of this disease. First of all, what we have to observe, their atrial and ventricular rhythms will be regular and the rates will be under 60 beats per minute. There's very simply the P wave preceding each QRS complex, a normal PR interval, normal QRS complex, T wave and QT intervals. There is nothing changed, but the rate will be less than 60 beats per minute. Now we go to the treatment method. In this case, the treatment is if the symptoms are not occurring, no treatment. If the symptoms, then identify and correct the cause that causes symptoms. Few drugs, atropine, dose 0.5 mg, rapid injection dose will be repeated 3 to 5 times up to maximum 3 mg. If epinephrine doesn't work, we'll go to if atropine doesn't work, we go to epinephrine, and if the low BP accompanies bradycardia, we'll go for the dopamine. For the chronic patient, the permanent pacemaker is treatment. Check the ABCs. The clues of symptomatic sinus bradycardia are hypertension, cool clammy skin, altered mental status, dizziness, blurred vision, crackles, dyspnea, and S3 heart sound, which indicate heart failure, and chest pain and syncope. The most important thing for children are the sinus bradycardia in a child is an ominous sign. So guys, that's all for today. Thank you very much guys.